Yeah. Here we have the oral cavity. The oral cavity starts from the lips and ends by the end border, the last border of the soft palate. And it's also divided into two portions. The first portion is the vestibula. This is the vestibula. هذا السبيس vestibula. If the pointer is here, you will say vestibular portion of the oral cavity. And here is the mouth proper portion of the oral cavity. As for the vestibular portion, boundaries, anteriorly the lips, posteriorly is the teeth and gums. And for the mouth proper, we have anteriorly the teeth, posteriorly is the opening of the opening of oropharyngeal opening, oropharyngeal isthmus or oropharyngeal opening. And the inferiorly we have the tongue, and superiorly we have the hard palate. That's all of it, contents and the things. But about the contents, also we have the tongue. The anterior 2/3 and posterior 2/3, divided by a sulcus terminalis, which is a V-shaped, apex posteriorly, and in the apex of it we have a foramen cecum. All these structures يعني أصلا ما مبينين. So بس تأشير على هذا نقول one of the contents of the mouth proper, which is the tongue. وعندي muscles of the tongue. والmuscles of the tongue عندي longitudinal, vertical هدول الخطوط الهاكذ، horizontal هاي اللي هاكذ جيت لي مثل السيركولار إذا مبيني بالفيديو. وهون عندي الجينوغلوسس، الجينوهايود هاي الجينوهايود، يعني من جوا هذا الخط تبدي الجينوهايود، واخير شي هذا الخط اذا مبين من هون بيدي هاي المايلوهايود، جينوغلوسس مسل. وهذول 3 muscles of the tongue. هذول كلهم قلناهم هسه الثلاثة هوني intrinsic muscles. هو tongue بينه intrinsic and extrinsic muscles. بالintrinsic we have the superior and inferior longitudinal and also vertical with transverse. And the extrinsic muscles we have the genoglossus, styloglossus, hyoglossus. ما مبينين styloglossus و hyoglossus، بس قلنا genoglossus هي هاي، وعندي genohyoid وعندي المايلوهايود. النيرف supply of the mylohyoid is nerve to mylohyoid، والgenohyoid كنا ذكرنا النيرف supply ماله بالprevious lectures. عندي أهم شيء هو الموتور supply of the old tongue is the hypoglossal nerve, and we have a sensory innervation also in addition to the motor. We'll divide it into general and a special sensation. The general for the anterior is lingual, and the special for the anterior part is the chorda tympani. And the general and the special sensation of the posterior 2/3, posterior 1/3 is the glossopharyngeal nerve. That's all about the tongue. We have here also a lingual tonsil, and here is the palatine tonsil. Oropharynx. It starts from the end of the soft palate here, and it ends by the very important structure, which is the epiglottis. The boundaries of it: anteriorly is the oral cavity, oropharyngeal isthmus. Superiorly is the soft palate, as we said, which is the pharyngeal, and here هذه الفتحة هي أصلا called as a pharyngeal isthmus and the soft palate. Inferiorly we have a part of the tongue and the epiglottis. Posteriorly we have C2 and C3. Laterally we have the palatoglossal fold والpalatine tonsil. وهذول palatoglossal folds anterior palatine fold and the posterior palatine fold. The contents of it is the uvula. Uvula اللي هي the end part of the soft palate. This is the uvula. Under it we have a red palatine tonsil, as we said, and we have the lingual tonsil. This is the lingual tonsil, which is yellow color. We have the epiglottis, which consists of an epiglottic cartilage and hyoepiglottic ligament. هذا الhyoepiglottic ligament very important, which connects to the hyoid bone. هذه القطعة هي hyoid bone، وهذه الhyoepiglottic ligament، وهذه epiglottic cartilage. We have a very very important clinical point here. لو أحد اختنق عصة الشوكة بداخل الأوروفارينكس، الحل يعني من بعد الكوف لازم نزيد الميوكال سكريشن. عشان نزيد الميوكال سكريشن يا إما عن طريق السلايفا، أنا زيد السلايفا سكريشن. عشان نزيد السلايفا سكريشن عن طريق إنه أخلي الشخص يأكل شيء يزيد السلايفا like carbohydrates، والأفضل هو الموز لأن هو بينه lubricating and very soft fibers in addition to sweets.